All right, we're live.
Thanks, Megan. Can you bring Brian over too?
Mhm.
Good morning, everyone. It's 8:05. This is Deanna Diamore, Health Director for City of Norwalk, calling the Board of Health meeting to order. Present, we have board members Norman Weinberger, Ken Lalim, Terry Quell, and Vincent Amaruccio. And we have Health Department staff, myself, Megan Fogno, and Brian Weeks, who are on. Good morning, everyone. The first item on the agenda is approval of the May 25th, 2021 meeting minutes. Do I have a motion?
I move that there be admitted.
Thank you. Dr. Weinberger moves. Do I have a second? Terry seconds. Do we have any comments, discussion, edits? All in favor, say aye.
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 Opposed, abstentions? All right, it passes unanimously. Thank you. The second item on the agenda is public participation. Megan, do we have anybody?
Yes, we do. We have somebody with their hand raised, so I'll unmute them.
Thank you.
You're unmuted.
Good morning, Diane.
Good morning. I didn't know if are you now putting the video on as well, or is it just the audio for these Zoom calls for the public?
I think their video, it says live on YouTube right now.
Can you see me? Because I don't.
I can't see you, Diane. I can hear you though.
Okay,
I'm not sure.
That's fine. It's okay because I'm having a bad hair day. So I know some of the city meetings are going to live video and this one is not yet. So that's fine with me. It's early in the morning. So anyway, good morning. Diane Lauricella is my name. And I know we've gone down a long road. The health department did a lot of really long and hard tasks for the last year and a half. The reason I'm here today, I have listened to other meetings and not spoken, but I felt the need to speak today, and I would like you to answer a question I will pose briefly. The circumstances have arisen where I'm, for instance, getting ready, as an example, I'm getting ready to attend a public event indoors in Norwalk. And I asked the organizers of the event what their COVID etiquette will be. What will they ask people to wear a mask? Will they ask people to show their ID, or at least verbally ask them, have their attendees, have they been vaccinated? The vaccine ID and it is causing a lot of puzzlement and anxiety with many, because there's a big question mark. And as you know, I had requested creative and robust messaging about mask wearing over the last year. And that was not to my satisfaction achieved, but I'm always willing to try, give it a go for a good old college try the second time, for the issue of this variant, the Delta variant. What is your department planning to do, either with the mayor's office or on your own, in some detail as to how to help the public feel, number one, understand whether for a public indoor event, what is the status of this Delta variant? I'm sure you'll be discussing it today. You have now a new epidemiologist, welcome. But it's not clear to the mass public, including some of my friends who are Hispanic. They shrug their shoulders, they don't know. I myself have been vaccinated, double vaccinated with Moderna. Many people have in Connecticut, but there still is the variant. And lastly, I just wanted to say, I would love my question to be touched upon during this meeting in discussion, but then if someone from the health department could call me so we could have a continued discussion about creative and robust messaging about our new normal, I guess, because it appears that the anti-vax people are being rewarded by nationally. I'm not faulting the local health department at all or alone. There is still mixed messaging about this, and it appears that the anti-vax people are rewarded. I was in CVS the other day, I am still wearing a mask indoors. I just decided that I'm going to do that. I've suffered a year and a half like other people have. And this variant frightens me, to tell you the truth. But people are walking in without any mask. One woman asked a person, have you been vaccinated? She got snapped at. I don't know if there's been any kind of unrest yet. I'm not hoping that there is, but the thing is, it's still a big question mark. So it would be great to have all the media cooperate with the city, the mayor. I'm not asking that he on a daily basis talk about COVID, but we need some really targeted messaging about the Delta variant and when people, it should not be left up to laymen, in my opinion. As a professional environmental health person, it's not fair that the federal, state, and local government leave it up to laymen that own restaurants, businesses, and museums, galleries. I don't think it's fair that we have to be the ones to decide what to do and to ask for whether to ask for the vaccine card, whether people should be wearing masks. I think that's the job of government, to help direct us. That is my view of government. This is a time when we need clarification again. And I appreciate you letting me speak. I would love to hear the discussion, but I would like someone from your department to call me so we can have a continued discussion. And I thank you for your time.
Thank you, Diane. Megan, do we have anybody else from the public?
There is somebody that called in. I don't know if they can, how they,
Do
I think,
you want to add them to over and see?
yeah. So if you're on the phone, I did unmute you. You would be able to speak.
All right.
Okay.
Hi, it's just Janet calling in.
Oh,
Okay.
great. We were hoping, we thought it would be you. Okay. Good morning, Janet. Additional Board of Health member has joined us at 6:13, Janet Karpiak. All right. Okay, so the next item on the agenda is the director's report. So wanted to share some great news about state funding, the per capita update. So I think I had mentioned in previous meetings that the state was looking at increasing the per capita rate for local health departments across the state. And so it's been included in the budget that's been passed, an increase of 75 cents per capita for local health departments that have a population of greater than 50,000 or districts with 3 or more towns. And so we had previously received $1.18, and state statute actually had been cut about 10% because it hadn't been fully funded the past couple of years. But now there's an increase in 75 cents. So municipalities will be receiving $1.93. So that's great news for funding for local health departments to see that increase in the budget this year. And so we're currently looking at that funding and previous funding and determining the budget for next year for that. We've also been looking at epi and lab capacity funding and updating that grant proposal. We submitted that last week. That's the funding that supports epidemiologists, the contact tracers, part of the salary of one of our public health nurses. So that funding continues until November 17th of 2022. And then there's what we call ELC2 funding. The state is looking at additional $20 million to go to local health departments across the state. And we've been in discussions with leadership at the state health department related to those funding needs. You know, they've been reaching out to local health departments and trying to determine what their needs are and making sure the funding meets the needs that are, you know, at the local level. So Not sure when that is going to become available or when we're going to be writing the proposals for that, but that's coming as well. Additionally, Teresa has been working with other partners on more funding opportunities. Brian has been supporting some of those grant applications with data, so it's been really great to have his support. We did partner with the state health department and the Family and Children's Agency for additional funding for the community health workers related to the health enhancement communities. So they worked on a proposal statewide, and that we are going to get funding for that. So we're really happy about that. So that's going to be able to continue on our partnership there. So a lot of great news funding wise, and seeing increased funding coming towards local health and community health. And those are our grant updates, funding updates. We also, I'm going to be providing some COVID-19 updates, and Brian will be as well. We also are looking at eventually bringing back WIC clients back in person. We had heard September, but we might be doing a piloting before. We're not sure exactly. We're working with Optimus and the state health department on that, but we're getting ready to bring back in-person visits for WIC clients. And we are also looking at right now at reaccreditation. Megan has done a great job in getting us all back together and figuring out how do we just finish up some of those last pieces, because that had been put on delay because of our COVID-19 response. So we're working on that as well right now, and just finalizing some of those last small items to then, once we get through that, then to schedule the site visit. If you remember, it's going to be a virtual site visit for reaccreditation. And I also am looking at strategic planning and all of that, because we need to update our plan. So more to come on that, thinking about the process and how do we improve it for, this next new plan that we're going to be putting together, and obviously want all of your participation and input into that process. So stay tuned for that as well. Any questions about anything related to any of those updates?
Dan, this is Ken. Do any of the funds that you're receiving or applying for are directed to specific parts of the workforce out there? I know that the workforce has been difficult. People have been getting grants, and there's some are so specific that for just community health workers or whatever it might be, and some are having difficult time fulfilling some of the obligations of those grants. Are we going to be able to fulfill our grant responsibilities, so all the funding that we apply for we can get?
So as of right now, yes. So what we've been asking for the state, so some of the funding, like the epi and lab capacity funding I mentioned, per capita, we keep asking for flexibility with the funding. And that's something that the local health departments have been advocating for, because, the needs in one community are different than the needs in another. So that's something that we've been really pushing for with the funding opportunities. For community health workers, it's great because we've been able to utilize their, with the Family and Children's Agency being employed for, COVID response, but thinking about long-term like recovery and other chronic diseases, we're looking at how do we apply that model that's worked so well in the COVID response and apply it to different areas within community health and health. So that's what we're looking to right now.
Yeah, I was wondering kind of the relationship moving a little bit towards like CDC kind of related issues, because they're gonna, typically this process won't go away. It'll be needed for other events.
Yep.
Thanks.
Sure. Any other questions? Okay, so the next item on the agenda is the COVID-19 updates, and Brian has a presentation. So Brian, do you mind going first, and then he's going to give an update on where we are with cases.
Sure. So yeah, I'll give a kind of general overview, kind of what the COVID situation is for the city. So let me just share my screen and I'll pull up my slides.
For those who don't know, Brian Weeks, anyone who's watching from home, is our epidemiologist.
So hey everybody, so you should be seeing the slides on your screen now. Good morning. And so kind of, good news in regards to our COVID update for the city itself. Now looking at just what the state health department provides in terms of COVID-19 county indicators, this is for the surveillance time period of May 30th to June 12th. The most recent time period the state has provided. This will be updated on Thursday evening. But the indicators by county is great, right? You know, if you look at the leading and secondary indicators, you know, every county in the state of Connecticut is in the low. You know, that's linked obviously partly to the seasonality that, you know, COVID follows, which, you know, it's following the year 2020 as well. But also, more importantly, the vaccination efforts, as well as obviously the prevention measures that have been enacted and people are following. Given the fact, especially that the state of Connecticut is one of the highest in terms of COVID vaccination rates compared to the rest of the country, too. And so if you look at it from a town and city basis, you can see pretty much everybody's in the gray. So what does that mean? That's less than 5 cases per 100,000 or less than 5 cases, reported cases in itself. And so what the state does, they just mark everybody in the same category, less than 5, which basically is in the lowest risk category, which is really great. You only have one town in the state of Connecticut that's in, you know, that has 5 to 9 cases per 100,000. But other than that, you know, especially obviously what we're focused on, Fairfield County and the city of Norwalk, we are in the gray in the less than 5 cases per 100,000 of the population as well. So again, time period being May 30th to June 12th. And so looking at just more specifically for the city of Norwalk itself, you know, the data that's pulled from the state health department just yesterday, you're looking at about 11,570 cases, 225 deaths, which has been holding pretty steady. And for the most recent 2 calendar weeks, so June 6th to 19th, the local processing of this data, you know, especially as we look at age groups, you can see how the largest proportion is the 20 to 29-year-old age group at almost 24%. And then it's almost tied for 10 to 19, 30 to 39, 60 to 69. So obviously this is a population that's of concern because, you know, in comparison to the other age groups that were eligible for the vaccine, they were later on in the process, along with obviously, you know, a portion of the 10 to 19-year-old age group, but also a much more mobile age group too. And so this is going to be kind of a continual thing we expect to see throughout the summertime. And so obviously part of our messaging is going to be including this age group along with just kind of like the standard precautions relative to less than 50 years of age, but nonetheless, not ignoring the fact that and overlooking the fact that still over 50 years of age, we are still seeing, you know, especially a 60 to 69-year-old age group having you know, a decent sized proportion in terms of COVID cases. And so obviously tailoring the messaging to appropriate parties as needed. And especially with the previous 2 calendar weeks too, you know, the greater than 50 years of age was actually a little bit higher in comparison to where it is now. But nonetheless, you know, as you can see, COVID's kind of just, you know, moving in its waves, ebbing and flowing relative to age groups. Nonetheless, this is a proportion. When you look at it from actual case numbers, it's actually very low. We're at actually like in the 20s now for the most recent 2 calendar weeks, where before the previous time period was about in the 30s. So it's slowly decreasing as well. So that's something also to keep in mind. And that's obviously a lot of that's linked to our COVID vaccination efforts. So what you're seeing right here is a map produced by the state for percent of the population of all ages who have at least received 1 dose of the COVID-19 vaccine. So this is data up to June 16th. That's 64% approximately in terms of the population that has been vaccinated. Now, keep in mind, when the state's processing this data, this is for all ages, so that's including also ineligible age groups. So, you know, less than 12 years of age that's included in this denominator. So technically this proportion or this percentage is actually higher. It's in the 70s. So that's something to really be excited about. As you can see, you know, especially this portion of Fairfield County is very much in the dark blue, which is closer towards that, you know, that full vaccination we wanted the whole population, especially if you look at in comparison to, say, the northeast side of Connecticut, which is definitely still more in the yellowish blue. So they have a ways to go. And even the commissioner has made a statement about that as well. And so obviously the big thing we're all focused on and obviously concerned about as well is the variants, right? Those are one of the biggest kind of potential game changers for the status quo in terms of our current trajectory, which is obviously we have a lot of things, you know, the wind at our back, so to speak. And so as you can see, you know, the big news is obviously the Delta variant, which is, you know, formerly called the Indian variant. You know, the state health department, if you look in the upper section for this time period of March 2nd to June 2nd, you know, it's somewhere estimated around at 0.5%. In terms of the specimens that that have been collected and processed by the states. Now there is a very specific process to it. Not all specimens are sequenced to determine what sort of variant they are. A lot of other kind of contingencies are tied to it. People obviously opt in to provide their specimen and let it go that extra step to be sequenced because it's an additional cost and additional laboratory process as well. But nonetheless, you can see how the alpha variant, which is at 41.5%, the second highest is the epsilon at 2.4%, 1.8% for the P1. And then you have, kind of tied is the South African or the beta variant and the Delta variants at 0.5%. Now that's the state surveillance. Now the CDC also is kind of like done, it's more of a national, if not global database in terms of processing for each state, collecting at a minimum of 300 specimens. Just to kind of really get a better idea what the proportion is. And so this is the time period, 4 weeks up to May 22nd. We're looking forward when the CDC updates this visual on their website, but this is probably a better idea of what the true proportion is. So obviously 55% or more than half is the B117 or the UK variant, which had, compared to the garden variety of COVID that we were dealing with, even with in 2020, had about, 50% increased transmissibility. And so then when you look at the Delta variant, B16172, that's at 3%. So it's growing in proportion, especially compared to their previous report last month. And it's expected, especially what, Anthony Fauci, as well as other public health experts have been speaking about, that, the Delta variant will enter greater prevalence and prominence in the United States, but also, it's projected in Connecticut too. In terms of overcoming even the alpha variant, because recent studies have indicated that the Delta variant is about 40 to 50% increased transmissibility. So you add 40 to 50% increased transmissibility in the Delta variant compared to the alpha variant, which the alpha variant increased just the garden variety. It's obviously a bit of an uphill battle, but we do have, again, the wind at our backs because we are having the summertime, so people are able to social distance more. People are aware of the prevention measures. We obviously better understand COVID. And obviously vaccination efforts are much higher, and they will continue forward as the summertime goes forward. I mean, obviously the city, as well as other partners in the state itself, as well as nationally, we're all doing our best to do outreach and get COVID vaccination to everybody, and especially specific communities, and educating individuals about the benefits of COVID vaccination. Because one of the biggest things is obviously reducing the severity of disease. So no hospitalization or no, obviously, other kind of complications that might occur, especially if obviously people are fully vaccinated, right? So again, I don't mean to kind of repeat myself quite a bit, but, this is the thing we like to really emphasize is ensuring that people are fully vaccinated. So that means getting, if they're getting the 2-dose series, they're getting the full 2 doses, and it's 2 weeks after those, the final dose, then somebody's considered fully vaccinated. So if somebody's rushing to travel because, it's still highly recommended that somebody doesn't travel until they're fully vaccinated, that, they wait that time period because, they're not really meeting that criteria. The human body doesn't move very quickly. You have to develop the immunity. It takes time. Everything takes time. So that also means planning ahead too. And also researching, right? So some people are, this is the big thing I always like to emphasize. I'll touch upon that very quickly. Somebody is planning to travel because that's a great opportunity to introduce not only the Delta variants, but any other variants that might not even be known. Because, again, sequencing is limited in terms of its scope, but also any others that do develop. So it's really important for even domestic travel, inside the United States, as well as international travel. People follow the current recommendations. You're still actually encouraged to wear face masks and take some other precautions when you're even out there, even fully vaccinated, in terms of just things to keep in mind as well. So really want to emphasize this point. It's on the CDC website. We've been including it in our, weekly mayor's newsletters and reports. They're very thorough. And that's one other thing I really want to kind of emphasize too, just for everybody to stay in the loop about what's going on with COVID. I'm just going to share my screen really quickly about this, but just to walk everybody through this document. We all put the health department as well as the mayor's office work very hard to put these newsletters out. It is actually publicized inside the Twitter feed as well as obviously on the city website. But, it has a letter from the mayor just talking about the current situation as well as other recommendations and things that have been developing. It has, obviously an outline, but also just kind of like local data. So what's going on with Norwalk relative to COVID cases and vaccination, as well as our case rates and comparing ourselves to other cities and towns in the state, because it's also important to benchmark ourselves and see where we're at relative to everybody else. Who's an outlier, who's not, because it's something to keep in mind. If somebody works somewhere else in the state, they have something else to kind of monitor and be advised about. Also just looking at age groups. So we have a nice pie chart kind of looking at the data, recent cases, just, what populations are being impacted. So that can help with even messaging from the community side. In addition to that, we also heat map relative to the city based upon each neighborhood with the density of COVID cases. So you can kind of see where some of these cases are picking up. There's usually not a lot of links to them because this is based upon residents of individuals. And so that's why this is also very generalized, because, we have to also be kind of concerned the stigma tied to COVID and, what we've been seeing with a lot of different communities being affected by that and people kind of taking action on that in some ways as well. But, we have to make sure that it's not identifiable. So this is why it's very generalized in this manner, but it gives you a rough idea what's going on in the city in terms of COVID activity. You also have COVID vaccination relative to different age groups from, just again, benchmarking the cities and towns, so the big 7 for the state of Connecticut, as well as our neighboring towns, and just seeing how we're stacking up next to them. This is like state data, so it's also another great thing. And, we're actually taking a little bit to the next level in terms of processing this data, just so you have this information right at your fingertips. In addition to all these other state analyses that we make readily available for everybody to have in this one document, so they can review it themselves as well as share with their other community partners. And so getting the word out there and keeping people informed. Vaccination, this is about hospitalization difference and just showing, generally how the trends have been decreasing with hospitalizations related to COVID, which is really important because it's a strong indicator of severity of disease, especially even with in relation to the variants. And then this also is variant surveillance. So we have, just kind of a quick tabulation using the state data, making that available to the public and maybe a nicer looking and not as crude format as the state has provided, but nonetheless making it available in this document, along with obviously just COVID vaccination efforts, other things in terms of basic needs allocation and testing sites that are open and what their hours are, as well as travel recommendations, food banks, things of that nature. And we update these documents often with just various other things for the population and everybody else to keep in mind. So those are those things I want to emphasize in terms of COVID. The other things we want to keep in mind, don't forget, there's also other diseases and other public health concerns and threats out there. The big thing right now, especially with this great, warm and wet weather that we're having, is also vector-borne diseases. So whether that's, ticks, which especially you might have heard the news about those 2 Powassan virus cases, which are related to tick transmission. The big thing that, I saw in terms of the state newsletter that we should keep in mind, in addition to what they've stated, is not only checking yourself as well as family members or other friends that you go out, whether you go hiking or you go outdoors, especially if you go into shrubbery or in the woods or forest, whatever it might be, and checking yourself for ticks and obviously taking the precautions to prevent acquiring those ticks and getting bites from them. Is also checking your pets. Pets are going to be a great opportunity because, they come to the house, people tend to overlook it, check the ears, check, where the joints are, things like that, wherever it might be, or folds in the skin, wherever these ticks can get to, don't forget some of them could be really small, smaller than even maybe a sesame seed. And then that could be an opportunity for obviously ticks to make it from their pet to eventually themselves, especially they sleep with their pet or, the ticks come off there and somehow it's a common area that somebody interacts with, whether it's the sofa, whatever it is, or their bed. The other thing obviously is mosquitoes. And that's what I really want to kind of emphasize too. Obviously it's a little bit earlier in the season, but and mosquitoes aren't at the volume and where they're going to be a full-on nuisance, but they are a nuisance right now. And this is really the opportunity to really stem the flow of mosquitoes in the population. So, when especially it rains, but on a weekly basis, individuals should be making an effort to really dump out any sort of sources that can collect water, whether it's, if you have tires in your front or backyard, you have bird baths, you're making sure to swap out that water. If you have garbage lids or other containers, flower pots, making sure to dump out the water that's collecting in there, because even a small amount of water can help house, mosquito larvae. And, it takes about a little more than a week for them to develop into full-fledged mosquitoes. So the big thing right now is not only just reducing the risk of transmission of West Nile virus, triple E, to the population, but also just reducing, just like with COVID, just getting in the early stages, reducing the opportunity for these mosquitoes to expand their geography. Right? Because that also creates opportunities in future seasons where those mosquitoes are now established. So we want to really mitigate that. And so if people can really just be on top of that and help with the messaging to really not have, epidemics upon epidemics and pandemics and all that kind of stuff, let's help kind of work on, mitigating the vector-borne diseases as well, because we don't need anything else complicating our lives, as COVID has done a great job doing that already. So that's my piece. Again, Brian Weeks here, epidemiologist in the Norwalk Health Department. Thanks.
Thank you, Brian. Really great presentation. Any board members have any questions for Brian?
Just a big thank you. It's a great report. Thank you.
Thank you, Brian. I also want to talk about the vaccination efforts that are continuing on. So I'm going to ask Megan to give a brief update first, and then I'll add anything after. Thank you, Megan.
Yes, thank you. Good morning, everyone. You guys can hear me okay? Okay. So we, still are busy doing vaccination clinics, like Brian mentioned. Thanks to him, we're able to use a lot of his, the data that he can pull for us at population and vaccination rates to really look at Norwalk specific and neighborhoods and the different populations. So on a weekly basis, we're still at the Maritime Aquarium doing weekly clinics there. And then most recently, we've been doing like pop-up clinics, really targeting certain neighborhoods or populations. So we've partnered with a local daycare provider to help vaccinate some of their families there and workers. And so we did an information session before the clinic to kind of drum up business, answer any questions that people may have about vaccinations. Also, just, we have some people just coming up asking about, we're looking to do an event. What can we do? And so giving some guidance on that as well during those information sessions. And then we followed that up the next day to do a clinic on site at the daycare center. So that was really well attended. And we're going to be looking to partner with other daycare providers in Norwalk and doing similar information sessions and then helping to vaccinate those family members. Really bringing the vaccine to people really helps. So it's not necessarily that they're really hesitant. It's just, they just don't have time. They're busy. They're, working families. And so just coming when they are picking up their children from their daycare provider and being able to vaccinate them right there on site was really helpful. So we didn't have to do much convincing. They were just very happy that we were able to vaccinate them on site. We're also partnering with Side by Side in St. Joseph Parish in South Norwalk to do a clinic next week there. And we're going to do the same style. So we're going to be, they have an English mass, a Spanish mass, and a Haitian Creole mass. So we'll be doing community outreach and education during those masses, just having a table out front and just, sharing some information, answering any questions, and then following up that week with a vaccination clinic on site, either for the families of Side by Side or the parishioners that attend the mass there. So we're looking to do that. We're also partnering with the Summer Meals Program. And so we're going to be at one of the sites vaccinating weekly on a weekly basis during the meal pickup time. So meal pickups are from 11 to 2. And so we'll be there again with the table to educate people and answer any questions that people may have, but also to vaccinate right on site. So as they're coming to pick up those summer meals, we'll be there to vaccinate. We're also have partnered with, and Deanna probably will speak a little bit more on this, but we're only one health department, so we only can be at one place. So we're going to be at one site, but there will be other community partners providing vaccines at other sites around the city during the summer meals program. So I'm really excited for this, just because you guys know there's so many summer meal locations around the city, and they're going to hit different people. So having providers at the different sites would be great to increase the vaccination rate in Norwalk. I think that's all my notes. That's it. Deanna, take it away.
Thank you, Megan. So I'll just add, so Teresa's continuing to lead the Vaccine Equity Partnership. If you remember, we got funding from the State Health Department for us and for our vaccine partners to increase vaccination across the city throughout the summer. And so she continues to meet with Norwalk Community Health Center, Community Health Center, Inc., Family and Children's Agency, who, we partner with them with the community health workers. And now GPH also participates in those meetings because, they have those mobile units that have been at multiple locations in the city, and they're always looking to continue to partner. So through all of those partnerships, the DPH vans were at Stu Leonard's. Our Community Health Center has been at so many different locations, as in the schools as well. CHC is looking to expand. They're partnering with us now on the Homebound program. But together we've been able to accomplish a lot. And so we'll continue that partnership throughout the summer. And as Megan mentioned, utilizing the data to really help inform where we go. And as Megan mentioned, the outreach, anytime we can do the outreach and the education and related to many different topics with COVID, whether it be vaccination or other, safety measures, we're always looking to be able to get that information out into the community. We also are, we continue to take calls from businesses and others who want guidance to us about reopening, different safety measures. So we continue to provide that. We continue to participate on Lamont Daniels, our Chief of Community Services, his community service provider meetings, calls every other week to provide messaging and communication and education on those calls. Brian mentioned the mayor's briefings, and he went over it, and he's always thinking about, well, what messaging should we incorporate? What should we include that people really need to be aware of? So we're continuing that. And then we also have our contact tracers. So now we have 2 full-time contact tracers who have been doing outreach on cases, but we're also thinking about how otherwise can we utilize their talents and skills to help with getting messaging out to the community. So we're thinking about that too. Does anybody have any questions related to any of Megan's updates or anything else COVID related?
I was just wondering how how the outreach to local businesses. This time of year, there's an awful lot of landscapers that are out there. Kind of interim kind of businesses. There's a lot of men hit the streets at the beginning of the day, and I'm just wondering if any local businesses have come forward and wanted you to do a clinic in their lobby or whatever it might be.
Yeah, I've been thinking about that, and we have a meeting at 10, and so I was actually thinking of like shopping centers, targeting those, like kind of doing an educational session, having our community health workers go out and meet some of those people, which they already are. So we already have some community health workers out in South Norwalk that have done educational sessions at like a laundromat, where they've gotten a whole bunch of people that are there. They're washing their clothes. They have to wait, to get their clothes dry, and they've done educational sessions there. And then told them, where they could go get vaccinated in the area. But just yesterday, it came to me because I was out somewhere, and I was thinking like, this would be great to go into some of these storefronts and just say, hey, if we come back tomorrow, would you guys like to get vaccinated? We could vaccinate all your workers, your customers right here on site. So sorry, Deanna, I don't know if I jumped in front of you, but I've been thinking about it. I have it on my list to talk about at 10 today, just to think of some other creative ways to do vaccines, not just you come to our clinic site, but we go to them more, which is what we're trying to do with all these community, like I call them pop-up clinics, but pop-up clinics.
Yeah, that last 15% or 20% or whatever is going to be the difficult to find. But those are the kind of techniques that we're going to need to get people vaccinated. No question.
In the same vein, we certainly in our clinic are seeing that the 12 to 16-year-olds are not coming forward as much as we would like. Any suggestions you have of how to outreach to those folks?
We can talk to Teresa and the community health workers about, specific, I don't know, Megan, if you know anything about IAP. So we're getting funding from the state health department to do additional outreach for vaccination. So Megan, we're going to be working with our IAP program on that, I'm sure.
Yeah, so I mean, you guys know Pam Bates, she's the immunization coordinator for the IAP program, and she does an amazing job in that role. And so I think once we have those additional IAP COVID-related outreach workers on board, we could really do some more targeting for the pediatrics age. I could see it, maybe partnering with, they're coming in for their school physicals, really trying to have the pediatricians push it then while they're already in the office to get vaccinated. I think also promoting it along with, the safety of if they want to do, extra activities and sports, that it's really important for them to get vaccinated. So I think it's going to be messaging, speaking with the providers to make sure that they're offering it and educating the parents and the patients on the vaccine. But it's definitely something that we'll speak with Pam about and see. I'm sure she has some ideas and some things up her sleeve.
Anything else? Any other questions?
Indiana and Vince.
Oh.
So I guess I just wanted to go back to the question that came up earlier on mask wearing. I don't think it's a question we're going to be able to answer today. Yeah, I think it's something that we need to get more information on and come back to the next meeting. But I am curious to see. So we all know about the CDC guidance. So I am curious about what the state jurisdiction is, what the local cities and the local towns jurisdictions are, and if we are putting out messaging about vaccines and other COVID related safeties, perhaps we should put out some guidance, if the mayor agrees, about mask wearing. But again, I don't think we'll be able to solve it today. But I can see the confusion, and perhaps it is a good topic for us to come back to.
I'd like to follow up to that comment. I have to say, as a board member, I find it very frustrating that Ms. Laura Cella continues to come on these public board meetings and criticize our staff and the hard work they have been doing over the last year and a half. And while I recognize that she has excellent expertise in environmental issues, this health department has worked tirelessly for a year and a half on weekends, on evenings, giving up vacations, family time, and we are following the guidance from the CDC and the state health department. And I personally, as a board member, find it almost insulting that Ms. Laura Cella continues to come and criticize this board and ask for personal phone calls. And I hope that in the future, Diane, you will support and not criticize the efforts of this very hardworking staff. Thank you.
Hi, everyone. Thank you for your nice words, Terry. I apologize, my computer froze, so I don't know what Vince had said, what his comments were. All I heard was it was related to masks and the question.
I do think that there's some merit to the question. When the CDC guidance came out myself, and I personally chose to stop wearing masks because I'm vaccinated, I did wonder to myself, what is the jurisdiction of the state? What is the jurisdiction of the cities and the local towns? Or even, is it just coming down to the businesses to let us know? So it might be helpful to have more information on it. And if we decide to do any messaging on it, to put out a thought on it. So again, I don't think that we'll be able to answer the question today, but personally, I can see how it could be a helpful question to answer.
So what we've been doing is we've been sharing, more about the CDC messaging. We've been really trying to promote that infographic from the CDC that shows like fully vaccinated versus not fully vaccinated. The state health department has issued a 4-page document with additional guidance, so we can certainly push that out and share that out more. We find that the CDC guidance is a good way to start because it's an infographic, it's easier to understand, and then the state health department has their information that's more in depth. That has more information. But if we want to discuss that more, at the next meeting, we certainly can, if the board would like to take that on.
Deanna, has there been any, I look at the date of, what are we at here? June 22nd. Flu season will be upon us in moments. And, we've had such a good response on flu. If you look at the statistics on flu this year, they're so far down from what has been in the past. And that's purely because we took general precautions, right? I mean, just general wash your hands, wear a mask, and distance yourself. I mean, those three things have kept the flu side of this thing. Has the state or anyone else, capitalized on the incredible work that is done by virtually every corner of the state and not missed the opportunity to say, look what we've done. We've knocked out flu. How do we do it again? It's kind of like, maybe it's the 6-month reprieve. We get the 6 months off and then 6 months on. But has there anything using any of that statistical information to help educate the public?
I know I've heard, the commissioner and others in, public presentations talk about that, allude to a little bit of that, about the fact that, look at our flu cases have been so down, and talking about the prevention measures that have been put in place. I know there's been some talk about, people may choose to wear a mask, continue to choose to wear a mask indoors because there are many benefits to it, that, preventing disease in general, infectious diseases. So I think we might see moving forward, this cultural shift, right? As we as a society that, there'll be people that recognize that, and that, going to the grocery store or going out to, think about, going out and about in your daily activities, wanting to wear a mask just because you feel more comfortable doing so. And so I'm not aware of like a formal communication campaign related to that, but we can certainly ask. But I think, that messaging that we've always promoted during flu season that, Megan has taught in classes, like showing the germs, right, that you have on your hand, and after you wash your hands, how they go away, and how you should cover your cough. And so I think a lot of that will be continuing moving forward, because it's been shown to work. We've all seen it this year. So, all right, I'm going to move on to the next agenda item, just community health updates. I want everyone to be aware that the garden program that we've had in the past is continuing this summer. It's starting. And so it'll be a new model this year. It'll be, farming and, gardening in the farm, but the nutrition lessons will be on Zoom. And so we're currently promoting that and getting people to register for that program. So we're excited that we're able to offer that this summer in a different way, in a new way, but also still be able to continue that great program. As you know, we weren't able to offer it last summer. That was my general community health update, and we've covered a lot of the other updates in previous agenda items. Anything else anyone wants to discuss before we wrap up today? All right. Well, thank you, everyone. Hope you have a good morning, good day.
Thank you.
Thanks, everybody.
Thank you.
Take care.
Great day.
Thanks.